Hello, my name is Jennifer Lopez, and I'm gonna read and translate chapters 1 to 4. 1. Health and illness. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as what is your general health like and how is your health generally. If you're in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Not ill, healthy, fit, fit and well, very well, in good health. Ill, unfit, unwell, unhealthy, not very well, not well, poorly, in poor health. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. When a patient says, I was sick this morning, possibly mean I was ill this morning, I felt unwell this morning, I vomited this morning. Or says, I feel sick, I possibly means I feel ill, I feel unwell, I am nauseous, I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good, full, complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about the change. Get over, get better, get worse. To recover, to improve, to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. She got over the illness very quickly. 2 years later, she remains in complete remission. I'm going to read now the exercises. Complete the table with words from A and B opposite. The first has been done for you. Fitness, fit, health, healthy, illness, ill, sick, sickness, sick. Make word combinations using a word from each box. Complete remission, feel sick, get over, poor health, travel sickness. Complete the conversation. Doctor, how are you feeling today? Patient, no, very well. How long have you feeling unwell? About a week. What is your health like normally? Very good. I'm usually quite fit and healthy. What is the problem now? It's my stomach. Do you feel sick? Yes. Have you actually been ill? No. Have you had any serious illness in the past? No, none at all. None at all. Um, choose the correct word for choose the correct word to complete each sentence. Her condition deteriorated and she died. He recovered and was allowed to go home from the hospital. The cause of sleeping sickness was discovered in 1901. The patient made a full recovery. I've been in good health for months and feel very fit. It was months before I got over the illness. He seems to be rather unhealthy. His diet is bad and he never exercises. Um, Moving to chapter 2. The next chapter, we got parts of the body 1. Parts of the body. Most external parts of the body have ordinary names, ordinary English names, as well as anatomical names. Doctors normally use English names, even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in the brackets below. I have jaw, neck, elbow, shoulder, armpit, upper arm, elbow, wrist, thigh, calf, leg, chest, breast, stomach or tummy, abdomen, navel, hip, groin, knee, and shin. You have here the back and the buttock. Limb. Limb means arm, upper limb, or leg, lower limb. The trunk is the body excluding the head and limbs. They're referring to parts of the body. When patients referring to parts of the body. When patients speak about their problem, they often refer to a part of the body. I'm having trouble with my hip, shoulder, knee. The doctor often needs to talk about a part of the body. Do you get any pain in the chest or in your chest, in your stomach, in the back? Describing radiation of pain. A patient is telling the doctor about his back pain and the parts of the body it radiates to. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh, to the knee. The sizes. By the ordinary English words for the corresponding anatomical terms in the table. Abdomen, common word is stomach, axilla, armpit, carpus, wrist, buttock, hip, cubitus, elbow, mama, breast, nates, buttock, patella, kneecap. Complete the sentences using ordinary English words. A male patient is craving angina pectoris. Like a tightness across my chest, and it goes up into my neck and into my left shoulder and down the left arm. A male patient describing the renal colic. It starts in the loin and gets into the groin and down into the testicle. Complete the sentences. Anatomical term. Inguinal swelling. I've got a lump in the groin. Abdominal pain. My little boy's got a stomachache. Periumbilical rash. I've got some spots around my navel. Thoracic pain. I've got a pain in the middle of the chest. Enlarged axillary node. There's painful swelling in my armpits. Mandibular pain. I've got a pain in my jaw. Complete the table with words from the backs. Trunk, abdomen, chest, and loin. Upper limb, we have wrist, arm, elbow, and fingers. And lower limb, we have leg, thigh, and knee. Make a list of words from A of Z that you find it hard to remember or that you need most often. Chin, navel, attack, and cough. The body too. The abdomen. The main organs of the body have ordinary English names, and doctors use these words. But when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, pancreas, have no ordinary names. So we have the pancreas, stomach, duodenum, gallbladder, liver, right kidney, left kidney, and spleen. This is a cross section of the abdomen viewed from below. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. The chest. The chest, thorax, contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into two lobes, and the right into three. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, your urine passes down to another tube called the urethra to the outside. The exercises. Label the diagram using words from the box. Right, the swim pipe, airways, lungs, lobes, two lobes, diaphragm, bronchioles, and the heart. Match the conditions with the organs affected. Hepatitis affect the liver. Pneumonia affect the lungs. Nephritis affect the kidney. Gastric ulcer affects the stomach. Cystitis affect the bladder. Angina pectoris affect the heart. Cholecystitis affects the gallbladder, and ulcerative colitis affects the large bowel. Complete the textbook extract. Examination of the abdomen. To examine the patients for a large abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the fingers upwards and inwards. Next, feel for the right kidney, and then across over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel the bladder, which is only felt if it's full. Chapter 4. Functions of the body. Eating. You're hungry, you're in a restaurant, and the waiter brings your food. You smell it, it stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food, it tastes good, and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. something has disagreed with you. The five senses. In addition to smell and taste, the senses include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the senses, doctors use the questions: what is your sight, hearing, sense of smell, sense of taste like? Or is your sight, hearing, sense of smell, sense of taste normal? To ask about the sense of touch, doctors talk about numbness, loss of sensations. Have you noticed any numbness in your fingers or toes? Other functions. The function speaking is verb speak and noun speech. Walking, verb walk and noun gait. Breathing or respiration, verb inhale and exhale, breathe in, take a breath in or breathe out, and the noun is breathe. Urination and micturition, urinate, micturate, pass urine, pass water, noun urine. Defecation, defecate, pass phases, pass stools, phases stools. Menstruations, menstruate, have a period, menstrual period, monthly period. When taking a history, doctors can ask, do you have any trouble, difficulty or problems walking, breathing, passing urine, or with your speech? Or do you have any pain when you breathe in? When auscultating a patient's lungs, the doctors tell the patients take a deep breath in, hold your breath, and then breathe out completely. Less common functions. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat or shake more than usual? Moving to the exercises. Match the symptoms to the questions. Dysuria, do you have any pain in your when you pass water? Dysphagia, do you have any trouble swallowing? Diplopia, is your vision normal? Dysphagia, do you have any difficulty with your speech? And dyspnea, what's your breathing like? Patients are describing symptoms of the conditions shown in the brackets. Complete the sentences. I've got a pain and numbness in both feet. I am having difficulty swallowing solid food. I have a lot of problems passing water. I've been sweating more than usual when it's not hot. I've noticed that my hands shake when I'm not using them. I have trouble breathing when I'm climbing the stairs. Complete the sentences. When I eat solid food, I have to chew it for a long time before I can swallow it. Do you have any pain when you pass stools? I have no appetite, and I've lost 5 kilos in the last few weeks. When did you last have a period? The garden is full of flowers, but my sense of smell has disappeared, and I can't enjoy the perfume. Take a breath in. You think a patient over to you. You think a patient may have diabetes. Think of 5 questions you can ask the patient to investigate further. Do you drink water more than usual? How's your sight or vision? Do you feel more tired than usual? Is your appetite normal? Do you pass water more than usual?